Hello, everybody. I am Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia, and let's continue. You are on a Dr. Y channel, my friends. Yes, we continue. Take your pens, papers, and we continue to talk about your big exams questions. The last exams in the medical university, medical institute, faculty. And today's questions are all about glomerulonephritis. Glomerulonephritis. Yes, pens and papers absolutely necessary to make the notes, my friends. Making the notes necessary for your remembering, for your memory. Okay, so question is, what is glomerulonephritis? Glomerulonephritis is a type of a kidney disease that affects the glomeruli, which are tiny structures in the kidneys that filters waste and excess fluids from the blood. In glomerulonephritis, the glomeruli becomes inflamed and damaged, which can lead to problems with kidney function. So we've got several types of glomerulonephritis: acute, chronic, IgA, immunoglobulin A nephropathy, lupus nephritis. Treatment of glomerulonephritis depends on the underlying cause and the severity of the condition. In some cases, treatment may involve medications to reduce inflammation and control blood pressure, while in more severe cases, dialysis or kidney transplant may be necessary. Actually, answering in this manner is largely sufficient for me, but anyway, they may continue. They means members of the jury. So, for example, when we talked about several types of glomerulonephritis, it can be acute glomerulonephritis. This is a type of glomerulonephritis develops suddenly, and it's usually caused by an infection, such as streptococcus, strep throat, or a skin infection. Chronic glomerulonephritis, the type of glomerulonephritis develops slowly over a period of years and is often caused by other medical conditions, such as diabetes mellitus or high blood pressure. Actually, always the good question: what is the first, diabetes or glomerulonephritis, or diabetes or high blood pressure? No, okay, all this is the same chain of metabolic syndrome. Immunoglobulin A nephropathy, this type of glomerulonephritis occurs when the immune system produces too much of a protein called immunoglobulin A, which can cause inflammation and damage to the glomeruli. And finally, lupus nephritis. And this type of glomerulonephritis is a complication of systemic lupus erythematosus, an autoimmune disease that can affect many parts of the body, including the kidneys. Actually, we can say that glomerulonephritis, in this or another way, is an autoimmune disorder also. Okay, so we see actually the etiology, question about etiology, question for Nobel Prize. So, etiology of glomerulonephritis can vary depending on the specific type of the condition we've got. For example, we have some common causes and risk factors associated with different types of glomerulonephritis. Acute glomerulonephritis. This type of glomerulonephritis is often caused by infection, mentioned above. Strep throat, actually some skin infections. Why not viral infections like hepatitis B and C, B or C? Concerning chronic glomerulonephritis, this type of glomerulonephritis can be caused by a variety of factors, including high blood pressure, diabetes, lupus erythematosus, and other autoimmune diseases, as well as some infections. Immunoglobulin A nephropathy, the exact cause of this glomerulonephritis is not known, but it's thought to be related to an abnormal immune response in the body. That's why it's autoimmune disorder. Lupus nephritis, this type of glomerulonephritis is a complication of another autoimmune disorder such as systemic lupus erythematosus, an autoimmune disease that can affect many parts of the body, including the kidneys. Other risk factors that can increase the likelihood of the developing of glomerulonephritis include a family history, no genetic determination of this condition, certain medications such as non-steroidal or NSAID, non-steroidal anti-inflammatory drugs, antibiotics, and some blood pressure medications, and exposure to certain toxins and chemicals, some illicit drugs, for example. It's important to know that in some cases the cause of glomerulonephritis may not be known, in most of the cases actually. And the condition is referred to as idiopathic glomerulonephritis. Idiopathic means a known reason. Then we've got pathogenesis, no, pathology, pathophysiology, pathogenesis. They involves glomerulonephritis. This condition involves inflammation. No, as other any disease is inflammation, of course, and inflammation that damage the glomeruli, or damage that provoke inflammation, which are tiny structures in the kidneys responsible for filtering waste products and excess fluid from the blood, as we said. The exact mechanism that leads to glomerular injury can vary depending on the type of the glomerulonephritis. In general, the pathogenesis can involve a combination of immune-mediated or non-immune-mediated mechanisms. Immune-mediated, not immune-mediated also, of course, is equivocal, distinguishing. But anyway, for example, triggering event. The development of glomerulonephritis often begins with a triggering event such as an infection, exposure to toxins, or just autoimmune response. I know that these discriminating features are vague, but anyway, so then inflammation. The question is pathogenesis. So the inflammation, the triggering event leads to the activation of immune cells and the release of pro-inflammatory cytokines and other mediators which can cause inflammation within glomeruli. Glomerular injury, the inflammation can cause damage to the glomerular basement membrane, which is a critical barrier that helps to maintain the integrity of the glomeruli. It's such a buffer. This can lead to the leakage of blood and protein into the urine, a condition known as a proteinuria. Scarring or fibrosis. Over time, the persistent inflammation and damage can lead to scarring and fibrosis within the glomeruli and the surrounding tissue, which can further impact kidney function. Chronic kidney disease. In severe cases, glomerulonephritis can progress to chronic kidney disease, which can result in irreversible damage to the kidneys and the need for the dialysis or kidney transplant. The specific pathogenic mechanisms involved in the different types of glomerulonephritis thus vary. For example, for immunoglobulin A nephropathy, abnormal deposits of immunoglobulin A within the glomeruli can trigger inflammation and damage, while in lupus nephritis, autoantibodies produced by the immune system can cause damage to the glomerular basement membrane. Classification. Glomerulonephritis can be classified in different ways based on various criteria, such as the underlying cause, clinical features, and histological appearance of the kidney tissue. Here are some common classification. For example, we have classification of glomerulonephritis based on underlying cause. So-called primary glomerulonephritis. So this type of glomerulonephritis has no known underlying cause and is considered as an autoimmune disorder. Secondary glomerulonephritis. This type of glomerulonephritis is associated with another underlying disease or a condition such as diabetes, lupus, or I don't know, infections that provoke developing of this glomerulonephritis. Actually, that's why it's a secondary one. Also, we've got classification based on the clinical features. Acute glomerulonephritis. Actually, I suppose this is the question, huh? The type of glomerulonephritis typically presents with the sudden onset of symptoms such as hematuria, blood in the urine, proteinuria, excess protein in the urine, and edema, swelling. No, of course, if we have acute, we have also chronic glomerulonephritis. This type of glomerulonephritis progresses slowly over time and is often asymptomatic in the early stages. Then we've got histological classification, based on the histological appearance. Minimal change disease. This type of glomerulonephritis is characterized by minimal changes in the glomerular tissue when viewed under a microscope. Focal segmental glomerular sclerosis. This type of glomerulonephritis is characterized by scarring and damage to certain segments of the glomeruli. Membranous nephropathy. This type of glomerulonephritis is characterized by thickening of the glomerular basement membrane. Finally, based on immunofluorescence findings, immunoglobulin A nephropathy. This type of glomerulonephritis is characterized by deposits of immunoglobulin A within the glomeruli. Membranoproliferative glomerulonephritis. This type of glomerulonephritis is characterized by deposits of immune complexes within the glomeruli. But it's important to know that these classification systems are not mutually exclusive, and the patient may have features of multiple types of glomerulonephritis mentioned above. A comprehensive evaluation, including clinical, laboratory, histological findings, of course, is necessary, absolutely necessary, to accurately diagnose and thus manage the condition. Clinical. No, clinics means signs and symptoms. Okay, so signs and symptoms can vary depending on the type and the severity of the condition. Some people with glomerulonephritis may have no symptoms at all, while others may experience a range of symptoms, including hematuria. Blood in the urine is a common symptom, maybe the main symptom of glomerulonephritis. This urine may appear pink, red, or brownish. Proteinuria, excess protein in the urine, is another common symptom of glomerulonephritis. This can lead to a foamy or frothy urine. Edema, swelling in the hands, feet, ankles, or face is a common in people with glomerulonephritis. This is often due to fluid retention caused by impaired kidney function. Yes, impaired kidney function. Hypertension, high blood pressure, is a common symptom of glomerulonephritis, especially in cases that are caused by underlying conditions such as diabetes, lupus erythematosus, fatigue. No, of course, that's common complaint. Many people with glomerulonephritis experience fatigue and low energy levels, which can be caused by anemia or by the body's immune response. Reduced urine output. Some people with glomerulonephritis may produce less urine that usually or experience difficulty urinating. Nausea and vomiting, toxic elements, toxic intoxication. These symptoms occur in some people with glomerulonephritis, especially in cases of acute kidney injury or uremia. And it's important to note that the symptoms of glomerulonephritis can be non-specific and may overlap with those of other conditions. Diagnosis. Yeah, diagnosis of glomerulonephritis. So involves diagnosis, involves a combination of clinical evaluation, of course, like any other conditions, laboratory tests, and imaging studies. Urinalysis can detect the presence of blood and protein in the urine, which are common features of glomerulonephritis. Blood tests can evaluate kidney function and detect abnormalities in the blood, such as anemia or elevated creatinine levels. Sometimes biopsy, no kidney biopsy, of course. A kidney biopsy involves removing a small sample of kidney tissue for examination under a microscope, histological. It can help diagnose the specific type of glomerulonephritis and guide treatment decisions. Imaging techniques such as ultrasound, computer tomography, MRI may be used to evaluate the kidneys and surrounding structures for any abnormalities. No medical history, physical examination. Healthcare professional, so doctor, may take a detailed must take a medical history and perform physical examination to evaluate any sign, symptoms of glomerulonephritis. Differential diagnosis. Okay. Yes, actually, the symptoms of glomerulonephritis can overlap very often with those of other kidney and non-kidney conditions. Therefore, it's important to consider the following differential diagnosis when evaluating a patient with suspect glomerulonephritis. Urinary tract infection, UTI, yeah? UTI. Urinary tract infection can cause similar symptoms of glomerulonephritis, such as hematuria, proteinuria. However, infections are usually associated with symptoms of dysuria, painful urination, urgency and frequency. Nephrotic syndrome is a condition characterized by heavy proteinuria, hypoalbuminemia, albuminemia, and edema. It can be caused by several underlying conditions, including glomerulonephritis. Actually, glomerulonephritis, we can say, it's a nephritic syndrome, not nephrotic, of course. Acute kidney injury, AKI. AKI is acute AKI. Yeah? AKI can cause similar symptoms as injury as a glomerulonephritis, such as reduced urine output, edema, hypertension. Injury is usually associated with rapid decline in the kidney function, whereas glomerulonephritis, of course, in most cases, is a chronic condition. Actually, chronic kidney disease, CKD, no, chronic disease, can cause similar symptoms as a glomerulonephritis, such as edema or hypertension and fatigue. But chronic kidney disease is usually associated with gradual decline in the kidney function over time. So actually, honestly, the same with chronic kidney disease. But anyway, lupus nephritis is a type of glomerulonephritis that is associated with systemic lupus erythematosus, SLE. So lupus erythematosus It can cause similar symptoms as other types of glomerulonephritis, but may also present with symptoms of lupus, such as joint pain, skin rashes, fever. Immunoglobulin A vasculitis, formerly known as Schenle-Genocha or Schönlein purpura, immunoglobulin A vasculitis, is a condition that can cause skin rash, joint pain, gastrointestinal symptoms with glomerulonephritis, actually autoimmune disorder as also. It's caused by inflammation of the blood vessels and can affect multiple organs. Actually, I don't know why it's no more Henoch-Schönlein purpura. No, I know, but not a question for today. Diabetes mellitus, of course, can cause similar symptoms as a glomerulonephritis, such as proteinuria and hypertension. Diabetic nephropathy is a common cause of glomerulonephritis in people with diabetes. Management. Treatment of glomerulonephritis depends on underlying cause and severity of the disease. For example, we have medications. Depending on the type of the glomerulonephritis, medications may be used to suppress immune system, reduce inflammation, and control blood pressure. Examples of medications that may be used include, first of all, corticosteroids, immunosuppressants, AC inhibitors, and angiotensin receptor blockers, Zartans. Don't forget about diet and lifestyle changes and health. So may we have recommend dietary and lifestyle changes to help manage symptoms and prevent complications. Actually, about complications, don't forget to tell. This may include limiting salt and protein intake. Very questionable, actually, about salt and protein intake. Very questionable, but it's write it like this. It's written in guidelines. What else? No, maintaining a healthy weight, of course, quitting smoking, and getting regular exercise and avoiding of alcohol consumption. Dialysis. In the case of severe kidney damage and no more kidney function, renal failure actually, dialysis may be necessary to help remove waste products, toxins, and excess fluid from the body. And finally, kidney transplant. In cases where the kidneys are severely damaged and unable to function properly, a kidney transplant may be considered. And complications and prognosis. Glomerulonephritis can lead to a range of complications and have a variable prognosis depending on the underlying cause and severity of the disease. For example, chronic kidney disease, glomerulonephritis, can cause progressive damage to the kidneys, leading to chronic kidney disease. Actually, glomerulonephritis is the beginning of chronic kidney disease, and in severe case, end-stage renal disease. Chronic kidney disease can increase the risk of cardiovascular disease and other complications, cardiorenal syndrome, etc. Hypertension. Glomerulonephritis can cause high blood pressure, of course, which can further damage the kidneys and increase the risk of cardiovascular disease. Once again, out of the topic, this is highly questionable. What is the first, hypertension or glomerulonephritis? Diabetes or glomerulonephritis? Proteinuria, excessive protein in the urine, proteinuria, is a common common benchmark, if you want, of glomerulonephritis and can indicate kidney damage. Persistent proteinuria can increase the risk of kidney failure or other complications. Infection plus, people with glomerulonephritis are at decreased risk of infections, especially if they are under therapy, immunosuppressant therapy. Actually, complication of treatment, medications used to treat glomerulonephritis can have very low severe side effects, such as increased risk of, as we said, of infection or long-term immunosuppression. Concerning prognosis, actually, the prognosis of glomerulonephritis depends on the underlying cause and severity of the disease. Some forms of glomerulonephritis can be effectively treated, while others may lead to progressive kidney damage and complications. So that's enough. We see 25 minutes. Of course, you don't have 25 minutes to answer one question from three. We've got three questions on the tickets plus clinical case. But anyway, thanks for your attention, my friends. Don't forget to follow and subscribe the channel. Not just subscribe, but follow the channel. Re-listening this video, like others, from my channel several times to remember. With this, you can remember the topic. Okay? So bye bye and God bless you. God bless you.